Just came out of Parkinson's Awareness Month, and we are now learning about some new research that may mean that a simple blood test might be able to detect the disease much earlier.
Yeah, science is amazing, isn't it? This could mean better control of life-altering symptoms. To tell us more, we have Dr. Ali joining us live in studio. Nice to be with you.
Nice to see you again.
Let's start with the first question. People have heard of Parkinson's disease, but maybe not everyone knows really what Parkinson's disease is.
So Parkinson's disease is when your brain is not making a certain hormone that tells your muscles to contract. This hormone is called dopamine. So we have an area in our brain which produces this naturally. But in some people, there's a disease where these neurons that produce these hormones, the dopamine specifically, they're destroyed. So you don't have the dopamine and the muscles don't contract. You start seeing the tremor as we see here. Sometimes it's very pronounced, but I want to stress that it's not always the classic tremor that people think about. Sometimes it can be something as subtle as a quiet voice or a personality change, or most often what we call bradykinesia, which is a fancy word for not being able to initiate movements as smooth as you once were doing before.
Doctor, why is the blood test we're talking about such a big deal here?
It is. So we used to just diagnose Parkinson's by just doing an exam and kind of guessing. Because remember, Parkinson's kind of symptoms can be caused by a variety of other diseases. Even some medications can cause symptoms of Parkinson's. So to diagnose Parkinson's disease, we would need to do a fancy brain scan. We would have to do a cerebrospinal fluid test. Now, this study that came out in Nature, journal Nature, 2 weeks ago, shows that we can now possibly look in the blood test for RNA fragments, which can tell us if a patient has Parkinson's disease. Now, this is not ready for prime time yet, but they're very certain that it's going to be coming in the future where you can just get a blood test and know if you have Parkinson's even before you start seeing any symptoms at all. So you can really get started on the treatment or rule out Parkinson's and look at their medications, look at other causes which could be causing, the slowness in your gait, the slowness in your voice, because everybody thinks Parkinson's is easy to diagnose because there's a lot of other things can mimic the symptoms of Parkinson's disease.
And of course, I know you recommend working with your neurologist and following their advice, but you also are sharing today that there are some exercises that could help some Parkinson's patients.
So the biggest thing I see a lot in my patients, and in fact, yesterday I was working with a Parkinson's patient, is that your balance is off. And we all know that with people with Parkinson's, they have this specific kind of gait where they kind of take short steps. We call this a shuffling gait. But sometimes also, if you notice, the person with Parkinson's has a difficult navigating a pathway. So when they get to a certain place where they have to turn, they kind of freeze. And these kind of freezing episodes makes it difficult for them to pivot. And the balance can be off. So some really good exercises that I teach my patients is to improve the gait stability.
We have about 45 seconds left.
So I'm going to show you something really easy.
Those exercises.
Step. You want to hold on to the back of a chair, and you want to simply just do a side step like this. And that kind of increases the balance a little bit. Also, you want to probably, with something to balance, to hold on to, you can put one foot in front of the other and try to keep your balance. And you'd be surprised, this seems easy, but with a person with Parkinson's, it's very difficult. And they also rely on their sight to keep things balanced. If we had more time, I could show you a lot more. Tai Chi has been amazing as well.
Now, is that something people should do a couple of times a day, once a day?
At least once a day, but first see your physical therapist because they're going to guide you. Everybody has a different level. They may have to start much slower and gradually ramp up.
All good advice and information. As always, Dr. Ali, we appreciate your time.
Thank you so much.
Great seeing you.